Hi, and welcome to this presentation from PI Connection. This is optimizing your PI case outcomes, strategies for greater success. If you're an attorney, right now you're not alone if you're frustrated and aggravated with your PI case settlement offers, the constant carrier pushback, providers that are missing critical injuries, and clients that are not made whole or maximally compensated. This is a common thread, and we at PI Connection can help create a bridge for you to overcome some of these issues. Now, you already know that you need providers to be PI savvy, stay current with the med-legal arena, be aware of med-legal issues that affect your cases and the claim, assist you with excellent case management, and deliver a consistent work product that you can rely upon. Now, there's actually somebody that can. Your personal injury solution is the providers and the doctors that work with PI Connection. Factors that can increase your cases are being missed when you don't work with PI Connection providers. These increase claim value, and they're all provider-driven. Injuries, conditions, and symptoms are extremely important, as you already know. Quality, objective findings. Personal injury has always been about objective findings that can then create a link back to the actual injury or precipitating event. When you have objective findings, now you can have specific and high-level diagnoses, getting your cases out of sprain strain or just being, air quotes, soft tissue cases. And of course, permanent injury is also something that can increase case value. When you work with providers that are able to deliver, your cases will take a tremendous change for the better. Now, with PI Connection, you're never going to miss value drivers again. The providers will be able to provide for you immediate benefits of early identification of two of the most common traumatic injuries. This will be done in weeks, not months or years or never. You're going to have quantifiable medical evidence, or sometimes called objective biomarkers, that again can create that link for you. And when you can, now you have causation. All of this is coordinated, layered, and validated by outside specialists, creating medical validation or a multidisciplinary approach to your cases. Now you have the opportunity to take settlements from average to optimized, or maybe even policy limits. The first injury that we're going to be able to identify and screen for you is the most common of the injuries missed in all of personal injury cases, and you know it as traumatic brain injury or mild traumatic brain injury. There are over 110,000 citations on this topic alone, and if you read some of the literature, you know that it's going to be in 50 to 70% of your motor vehicle crash cases have a TBI. And of that, 80% are categorized as mild TBI. Most physicians can identify a moderate or severe TBI, but it's those mild TBIs that often go undiagnosed. How many times have you had a client sitting in front of you that's been released from care and still continuing to complain? How many times have you opened up a file and looked and seen possible evidence of a TBI, but no workup, no diagnosis, no referrals, no objective findings? That significantly handicaps your ability when it comes to the settlement process. Well, with PI Connection, we can help you with that. First of all, let me just share with you the concussion grading system put out by the American Academy of Neurology. There are many definitions of traumatic brain injury, but this one deals with altered mental status. And if you look at the symptoms, headaches and dizziness and mental status change, Over on the left-hand side, there's a grade 1. Over on the right-hand side, it says symptoms or mental status changes that last more than 15 minutes. Well, if a patient winds up in a provider's office and they have headaches or mental status changes, by filling out the right forms, you're already on the path to documenting a traumatic brain injury or concussion. And no longer is loss of consciousness, as you see there, no LOC, necessary for a traumatic brain injury. Now, when providers or urgent care or emergency departments do the wrong test, not only do they waste money, but there's minimal chance to detect the MTBI. If you see here in the first sentence, both CT and conventional MRI are established modalities to rule out severe complications, skull fracture, intracranial hemorrhage, brain edema. However, if you look down, moreover, conventional CT and MRI have proven insensitive to more subtle changes in the brain, such as diffuse axonal injury, which is the most common injury in MTBI. So your clients can still have a TBI, but if the wrong test is being done, there's minimal to no chance of actually objectifying it and detecting it. Your clients are presenting not only to your office, but to the providers with cognitive and physical symptoms that are just being missed, underdiagnosed, or ignored completely. Memory, headaches, forgetfulness, issues with concentration, sleep disturbance, mentally foggy, visual disturbance are all signs and symptoms of TBI. And you may be aware, headaches are the #1 symptom after a motor vehicle crash. Now, where it's coming from, we're going to help you with that. Our providers are going to perform early QEEG evaluations that can help to identify and objectify the MTBI. Visual processing, auditory processing, reaction time, all of these can be objectified with our QEEG and documented here within a sample report. Now you're also going to have the ability with eye movement testing to identify TBI in as low as 8 miles an hour impact. Here is a research study showing that eye tracking as an objective measure for underlying neurological health in the presence of a TBI. Our providers are going to be able to run these tests, QEEG and eye movement assessments, to help you identify and screen for TBI early, create this foundation for your cases. Here's an example. I like to call the eyes are the windows to the brain. On the left-hand side, you see a moderate TBI in a 17-year-old male. At the top right, the score is 48. Over on the right-hand side, there's no TBI in a 56-year-old male. The score is a 97. If you look down the middle column of saccades, you can see a huge difference from the left to the right, as well as smooth pursuits and other issues that the eye movement assessment evaluation is now going to be able to be picked up. And all of these tests are evaluated, validated, and reviewed by outside neurologists. Now, I didn't introduce myself, but my name is Dr. Scott Tauber. I'm a national speaker on personal injury. I've been asked to speak at state association events and at med-legal conferences. I speak to attorney firms around the United States, helping their providers to improve the personal injury aspect of their practices. I have my own seminars and webinars, and I've been working with providers in personal injury for over 25 years. I've been published in national journals and have been an expert witness in both plaintiff and defense med-legal cases and a consultant to the auto carriers. Now, I don't say this to boast or brag, but to just give you the confidence that this information is being taught out there, and now your cases can benefit. Your clients can actually get an accurate and reliable diagnosis, which you can now take to the carrier to present objective biomarkers or medical evidence of their injury. The other injury that's missed way too often is spinal ligament injury, sometimes described as instability or laxity or AOMSI. Traditional X-ray and MRI are missing this every single time. Your clients, when working with PI connection providers, are now going to have the ability to have their spine evaluated in motion. Get the cases out of sprain strain and the limitation that a lot of carriers like to put on that diagnosis. This injury is a significant claim value driver. It has its own ICD-10 code. It's objective and quantifiable and gives you and your clients an accurate diagnosis. And it's supported in the AMA guides and literature studies. An accurate, specific, sensitive, and reliable test to evaluate the spine when clients have neck and lower back symptoms. Now, you may not know that MRI is not always helpful. This comes from the Spine Journal, which is sort of the granddaddy of neuromusculoskeletal journals. And basically, what it says is where the patient obtains his or her MRI and which radiologist interprets the examination may have a direct impact on the diagnosis, subsequent choice of treatment, and clinical outcome. They did a study of the same patient going to 10 MRI centers, and there was quite a bit of variability. Now, how does that affect you? Well, if you're sending your clients or your providers are sending clients for an MRI, well, they're relying on the report, which may have some issues. Or maybe you've had this experience. There's a small left-sided disc protrusion, a tiny central disc protrusion, a probable 3 millimeter central disc protrusion. None of that really helping the case when they're using descriptive terms. This technology can actually begin to identify the spinal ligament injuries and take your cases from good to great. The technology that I'm talking about is called vertebral motion analysis, or VMA. It has been featured on the Today Show. As you can see there on the lower left, Dr. Nancy Snyderman stated, the first time we can really see the spine move. It's the technology of the future. On the top, you actually see a patient going through the process. And on the right, we're able to see the spine move, place measurements to see if there's any instability or excessive motion, which now is a tremendous value driver and diagnosis. Here's a little different view of it in use on the Today Show. The VMA, you should know, is FDA cleared, it has patented technology, and it's a proprietary diagnostic. It has also passed Daubert challenges. And on the right, you have Brett Favre, who had spinal pain, had x-rays, traditional x-rays, and an MRI, and wasn't able to identify the root cause, the pain generator of his pain. But this technology was able to do so. And now your clients that have neck pain and lower back pain can get these tests done to help identify this injury. Now, if you're thinking, I've never heard of this before, or I've never seen a patient with this, these injuries have been around and well documented in the AMA guides all the way back to 2001. In the 5th and in the 6th edition, sometimes you'll hear it referred to as AOMSI, or alteration of motion segment integrity. This injury will be in a high percentage of your cases and is the underlying pain generator for patients that have neck pain, stiffness, radiating pain, low back pain, stiffness, radiating pain as well. This is something to consider when your clients have a spinal injury. Straight out of the AMA guides, loss of motion segment integrity is rare, and I quote, unless accompanied by trauma. So if you're thinking this is a chronic injury, this is something that they've had their entire life, or because they had some other sort of spinal problem, the answer is no, is that this was clearly defined as a trauma-based injury. And if you look at the amount of injury, translation of the spine cannot be more than 3.5 millimeters in the cervical region. In the lumbar, it's a little bit different, but the height of a quarter is 1.75 millimeters. 2/4, that distance is all it takes to be able to give a diagnosis of spinal ligament instability, which may then go ahead and lead to a permanent impairment, which of course you know is a tremendous value driver. Now, this has been in the literature. On the left-hand side, you can see the ligamentous injury in human lower spine. The laxity of these injured ligaments provide negligible support to the spine, resulting in nearly identical kinematic responses to spines that don't even have ligamentous support. And on the right, diagnostic accuracy of video fluoroscopy, which is the way this test is done with a video fluoroscope for symptomatic cervical spine injury following whiplash trauma. The conclusion, the video fluoroscopic examination of the cervical spine is a highly accurate test for identifying patients with symptomatic ligamentous instability after whiplash trauma. The imaging modality should be utilized more widely. The VMA itself is validated in the literature as being a tool and software and instrument for sensitivity and specificity and measurement accuracy. Each time your client gets a test, reports are generated. On the left, you see the written report. On the right, you can see in the red circle 5.1 millimeters at L1 and L2 in the lumbar spine. Anything greater than 4.5 is ligament instability. Reports are read and validated by outside independent radiologists. Now, what are attorneys saying about this? And I'm sure you probably thought and said this as well. I'll thank you for capturing medical evidence before it disappears. Big cases start with quality objective findings. When carriers see objective evidence of injuries, it's more difficult to contest the injuries. And then there really is one issue to negotiate: case value. When it's documented correctly and objectified, it changes our whole approach with the carriers. I'm sure you've already had clients that have had objective findings. For example, a laceration. That's an objective finding. That's not arguable. The same thing with the TBI evaluation, screening, and testing, and the spinal ligament instability and laxity testing as well. All right, so what's the process? Well, for you, you get your own HIPAA compliant portal, and you'll have access to everything your clients are going through. When you refer clients in, you now have access to all the reports and everything, so you know exactly what's going on with your clients. The way the process goes, however, is the provider sees the patient, does what they normally do, their history, outcome assessments, initiates care, creates that foundation. There's a telehealth or telemedicine appointment to incorporate medical validation within the first few office visits. If your patient is a candidate for TBI and AOMSI, then we proceed. We communicate with you, the representing attorney, to share what's happening and the importance and the validation and clinical rationale for these tests. The patient client has the tests done, and they're available in the portal within 72 hours. We handle all the billing on a lien or LOP. What's your next steps? Right now, you have clients and cases that probably are sitting in front of you right now, and you're wondering, they're still symptomatic, they've been released from care, what do I do? Well, here's an opportunity to actually run some diagnostics and see if there's an underlying TBI or ligament instability. You may have received a carrier lowball offer. How do you counter that? You need objective findings. You may have clients treating with other providers that need this technology, just the diagnosis, not necessarily treatment. Your future clients, they may need treatment management and diagnostics. This provider will be able to give that to you. Now your cases can settle easier, faster, and for greater value. And in fact, the first 2 cases that you refer in, either for TBI or AOMSI, will be done at no charge. We also want you to see the benefits for yourself. So set up a time to meet the doctor and their team. View the diagnostics in action. See actual redacted patient reports and discuss opportunities to optimize cases and assist your clients. Also, current and future clients in a referral relationship where the provider can refer unattached cases into your office. Thanks for watching. Please let us know if you have any questions. Reach out to the provider who's now going to be able to optimize your cases, identify objective findings, and give you a whole new opportunity in your settlement process.